Hi, I'm Becky.
I'm Naomi.
I'm a GP, so I'm a doctor in general practice.
And I'm a doctor in sexual health.
And today we're going to talk to you about sexually transmitted infections and how you check and treat those. So should we start at the beginning? What is an STI?
So an STI stands for sexually transmitted infection, which is basically what it says on the tin. It's an infection that's transmitted through sexual intercourse.
Okay. And can anyone get an STI?
Anyone can get an STI.
So no matter what sexuality you are, what position you're doing, how clever you think you're being, you can still get an STI.
You can still get an STI.
So I'm in a new relationship then, and we've been using condoms, or my partner's been using condoms, say, and we don't really want to use the condoms anymore. So what do we do next?
So we'd always advise coming down to a sexual health clinic or your GP and asking for a sexual health check before you stop using condoms. Mm-hmm. So condoms, as we've discussed, are really good for preventing sexually transmitted infections, but it's often the case that people just get bored of using them, or they're in a more stable relationships, they stop using them
properly.
Yeah, but that doesn't mean that nobody has a sexually transmitted infection. So if you do go to the clinic, it's so easy to get tested. You don't even need to get your genitals out to be looked at by anybody.
So your knickers can stay on?
Knickers can stay on. We have to take them off in the bathroom to do the swab, but you don't have to show your genitals to everybody, which is kind of, I think, what puts people off. So if you came to see me, for example, Becky, I would ask you to do a swab in the toilet.
Yeah. Myself.
Yourself.
So I would take this swab to the toilet, shut the door, I'm on my own.
Exactly.
Okay.
And all it is a swab into the vagina.
Yeah. So stick it up, wiggle it around,
pop it in the tube, and then bring that bit back to the doctor and they'll label it up.
So they're not going to be looking at my vulva, they're not going to be putting microscopes on and big lights.
No.
It's just me and that swab.
Yeah.
That's it.
And if you didn't want to go to your GP or a sexual health clinic, you can order them online.
Wow.
So you can do it in the comfort of your own home.
Okay.
Yeah. What we'd always advise is so these swabs test for gonorrhea and chlamydia. Mm-hmm. And if you were a man, we should probably mention the men as well, mm-hmm. all the men have to do is do a little wee in a pot.
Wow, they really do get off lightly. Yeah. There are no excuses here, are there?
So that, and depending if you're having anal sex, for example, we can swab from the bottom, or oral sex, you can swab from the throat. Mm-hmm. And these swabs will check for gonorrhea and chlamydia, and they're the most common sexually transmitted infections.
And can you treat them?
You could 100% treat them, yeah. Okay. So but we need to know that they're there, and the majority of sexually transmitted infections show no symptoms. So most people are walking around thinking that they're absolutely fine, but they may have chlamydia or other infections.
So there's no way of knowing unless you go for your check.
Exactly.
And then how do you get treated? What is treatment?
So if you had gonorrhea or chlamydia, we would treat with antibiotics.
Just antibiotics?
Just antibiotics.
Just like that?
Yeah.
And would I need to come back and check that it had gone?
So we always advise getting rechecked about 3 months later, more to check that you've not been reinfected, because obviously we need to track down your partner and make sure you've both been treated at the same time.
Okay. And how do you handle that tracking down your partner issue?
That's a very good question. So it depends on how you want to do it if you come into clinic. So you can contact them yourselves, or if you want to do what we call anonymous partner notification, we can send out an anonymous, it's a text saying you've been a contact of an infection. We never disclose what the infection is, but we just encourage people to come in and get tested.
Okay, so it's handled very carefully.
Very carefully, yeah. We're very aware that this is a very difficult, sensitive issue for lots of people. Wouldn't be right in saying that this is not the complete MOT. So gonorrhea and chlamydia are very important, but another 2 infections that are very, very easy to test for are HIV and syphilis, and that's done on a blood test. Mm-hmm. So just one simple blood test from your vein in your arm, and that can test for HIV and syphilis. So we'd always encourage anybody coming through sexual health to have all of those 4 infections tested for.
Fantastic. And talking of HIV, we're wearing the lovely t-shirts. Thank you, saving lives. We've had some questions about HIV. Mm-hmm. What is HIV?
So HIV is the virus that you pick up. So human immunodeficiency virus. And some people may have heard of the term AIDS. So that's acquired immunodeficiency syndrome. So that's what happened. That's the syndrome that happens before people die of this infection. So nowadays, people who have HIV or people living with HIV can live normal, healthy lives. So we have amazing treatment now. People can go on to have babies without transmitting the virus. If you are having sex with someone with HIV and they're on treatment, you cannot get the infection from them.
And that is an astonishing thing, isn't it?
It is.
So you can lead a normal life, you can feel well, and you can feel safe in the knowledge if you're on your treatment that you're not going to infect your sexual partner.
Yeah, and the really important thing is to know that you have or you don't have an infection, because again, with HIV and syphilis, gonorrhea, chlamydia, warts, herpes, all these things, most people don't know they've got them. So unless you know you've got them, you can't then prevent transmission.
Fantastic. And this is your daily bread, Dr Sutton, is it not?
It is. This is my day-to-day job. But please come and get a health check, a sexual health check. It's really easy, it's free. It shouldn't be embarrassing, because obviously you can do your own swabs, and this is literally what we do every single day. So, you know, don't be embarrassed, don't be scared. It's literally
It's a cinch.
It's much nicer than going to the dentist, and we're supposed to do that every 6 months.
Yeah. And every new partner you might have, you need another check.
Yeah,
Yeah.
exactly.
Fantastic. Thank you very much.
Pleasure. Thank you for watching.